Welcome back to another episode of the Wellbeing in Medicine podcast. In the last episode, we talked about something that many physicians experience but rarely name. We talked about spillover. It's what happens when the work of medicine doesn't stay contained inside the workday. Instead, it leaks. It leaks into evenings, into weekends, into family time, into our attention and our presence. And over time, that spillover quietly fragments the quality of our life. But today, I want to talk about the structural solution to spillover. Because spillover is not primarily a discipline problem or a motivation problem, but a systems problem. And the missing systems skill in modern medicine is something that I call containment. It's what allows the work of the day to stay largely inside the workday. It's what allows physicians to think about the workday and to be done. It protects attention, presence, and recovery. And the reason containment matters so much is because without containment, the work never actually ends. Medicine teaches competence, not containment. If you think about medical training, we spend years learning competence, how to diagnose, how to build a differential diagnosis, how to treat, how to make complex decisions under pressure. We learn physiology, pharmacology, procedures, communication. But there's something we almost never learn. We almost never learn how to truly contain the work. In residency, we simply absorb the teaching. Work just continues until it's done. And doing right by the patients often includes that, but eventually charting starts following us home, results, the pagers, or whatever your secure messaging is, inboxes follow us home, and because that pattern becomes normalized early in training, many physicians enter attending life believing that spillover is just part of the job. But what if it isn't? What if it isn't inevitable? What if it's actually the predictable result of a lack of containment architecture in the workday? The lack of structure built into it. There's the structural system side of things, the system that we work in, but then there's also how to design that system for yourself. There's the macro system, and there's the micro systems that you live in, that you use to get your work done. So when I use the word containment, I'm not talking about perfection. Containment doesn't mean that every task is finished immediately. Rather, containment means that the system of the workday is designed to close loops whenever possible. It means that decisions are resolved earlier. Notes are completed earlier, maybe even in the room. Messages are triaged earlier. Loose ends are minimized. Containment means the day has structural closure points. Without these closure points, tasks accumulate indefinitely. And accumulation leads directly to spillover, the pajama time, the evenings, that lack of margin. So there's a difference between efficiency and containment. Most workflow conversations focus on efficiency, typing faster, templates, shortcuts, dot phrases. And those things can be helpful, and I talk about them a lot as well. But efficiency alone doesn't create containment. It doesn't create this margin. You can type quickly and still have lots of unfinished loops out there. Efficiency moves tasks faster, but containment finishes them sooner in the workflow. And that difference is enormous, because unfinished thinking is what drains attention. And the real problem here is unfinished thinking. When we talk about charting, people think the burden is just typing. But typing actually isn't the hardest part. The hardest part is the thinking, the synthesis, the critical thinking. What's going on? The diagnostic reasoning, documentation decisions, what to put in the note, what to communicate, how to communicate for the patients, for the specialist that may be reading the note. Each of these requires cognitive effort. When we defer those decisions, they remain open loops, and open loops consume mental bandwidth. This increases our emotional load and ultimately leads to emotional exhaustion. Containment, on the other hand, happens when these loops close earlier in the day, not later in the evening, not after dinner, not at 10:30 at night when you're trying to remember the details of a patient you saw 8 hours earlier. Containment brings the thinking closer to that encounter. But spillover often feels normal because containment can be missing in many clinic workflows that were never designed with containment in mind. Schedules are built for access. Documentation expectations are just layered on top of that, with inbox volume growing, administrative tasks accumulating, more and more checkboxes to mark for quality, things that you may already be doing, but just extra things that you have to remember to do, and you get structurally overloaded. And when things get overloaded, something eventually has to move. And what ends up multiplying is the documentation time, which often shifts into the evening. We normalize it. We say things like, I'll just finish the notes tonight. I'll catch up later. I'll close charts after the kids go to bed. And over time, that pattern can become routine. It might happen occasionally, but it doesn't mean that it's healthy, especially if it becomes the norm. It becomes common, and it becomes normalized. Containment, on the other hand, is able to protect attention, and that's what makes it so important, because attention is one of the most limited resources that physicians and all humans have. Every patient requires it. Decisions require it. Difficult conversations require it. But when attention is constantly divided between the present moment and unfinished work, the quality of these decisions, these conversations, decreases. Containment protects attention by allowing physicians to mentally release that part of the workday. That decision is done. When the day has structural closure itself, the brain stops tracking these unfinished tasks. In the mental quiet, that margin is incredibly valuable. It allows for recovery, for presence. It allows for creativity and reflection to return. It offers the opportunity to invest in yourself, in your hobbies, in working out, and spending time with family, with friends. This matters. But there's another aspect of containment that physicians often overlooked. Containment protects identity. Medicine is an identity-heavy profession. Many physicians care deeply about their work. But the work, if it has no boundaries, it begins to consume the rest of life. Without containment, the role of the physician quietly expands into every hour of the day. You end up always partially working, always partially thinking about patients, carrying these unfinished tasks with you. Containment creates space where other identities can exist. Parent, partner, friend, human being. Without containment, these roles compete with unfinished clinical work. Now we get to the myth of infinite capacity. Part of the reason that containment often gets ignored is that medicine operates under the assumption that physicians have infinite capacity. Just a few more patients. Just a few more messages. Just a few more tasks. Individually, those additions seem small, but collectively, they overload the system. And when this capacity gets overloaded, things start to fail. Tasks begin spilling over. Even highly efficient physicians can't contain work in a system that continuously exceeds its capacity, which means that containment is not just an individual skill. It is also a structural property of the system itself. This is part of the quadruple aim. It's cost, quality, patient satisfaction, and the well-being of those providing the care. So what does containment look like in real life? Containment can take many forms. It can be real-time documentation, closing out decisions during the visit. It might mean structured inbox triage, protected follow-up slots, clear thresholds for what must be finished before leaving clinic and what could wait till tomorrow. None of these require perfection, but they do require intentional structuring of it, intentional thought into how these processes work for you. Instead of letting work accumulate passively, containment actively closes some of these loops throughout the day. Ultimately, this structure and creating containment, these boundaries, can create margin. And margin is the small amount of extra space in the day. Space for interruptions, space for complexity, space for human connection. Because without containment, margin disappears. Every loose end gets pushed later into the day. You don't have those extra minutes to give to a patient who really needs that listening ear, that extra moment to say, this is really hard, and this is the help that I need. And you might choose to offer some of that time, but it ends up coming out of your evening. The going home later, missing part of dinner, when you otherwise could have had the structural containment of some of your visits that allowed you to then have the margin to be there in those big moments for your patients and be able to get home to care. Because when you're able to care for yourself, you are able to do life in a sustainable way that is able to keep going, to be able to keep investing in what matters to you. Because the deeper reason that containment matters is that it makes medicine sustainable. Physicians aren't machines. This cognitive work requires recovery. This emotional work, this secondary trauma requires recovery, requires opportunities to engage outside of yourself and to receive help when you're like, this is really heavy, because it is. It gives you the opportunity to give your attention to things that are life-giving to you. Because when spillover increases, recovery decreases. And the increase comes in the likelihood of burnout. So containment is one of the simplest structural ways you can build those microsystems that allow the day to end, that allow decisions to be able to not just hang over you. And so when physicians think about charting problems, they often ask, how can I finish my notes faster? And that's a great question, but maybe a deeper question could be, how can I design a workflow that allows systems to, my notes to be all done, my workflows to be contained to the workday? It takes a broader look at things. And that shift can change everything. Because instead of one large documentation block at the end of the day, containment distributes closure throughout the clinic session. Each encounter can close more fully, sooner, with decisions that are closer to when they actually were relative to that patient. It allows you to finish more in the moment. It's not something that we were taught. It's a skill. It's a structure. It's something that's built. And it requires awareness of our workflows, what we want them to be, the tasks and decisions that may be delayed, and how we can close open loops. Once you start noticing these patterns, containment becomes possible. But until you see them, spillover feels inevitable. Ultimately, this containment, this margin is not just about finishing your notes. It's about protecting attention and presence. It's about allowing physicians to practice medicine without sacrificing the rest of their lives. It's about creating a system where the work of the day can actually end. Because when the work ends, something important happens. Attention returns, energy returns, human connection returns, and medicine begins to feel sustainable again. Maybe it never truly did before, and yet it can for you. It's possible. I'm living proof of that because, again, I was burned out 8 months out of residency, and now by implementing my own system, I'm thriving. And I'm here to pour into you and to help others in medicine thrive by building the systems to help you finish your work at work. And so if this is you and you resonate with this, you want to build your system, your structure to help you with your containment, to help you build that margin so you can be home for what matters most to you, I want you to check out my Finish Charting Faster system. You can learn more and get in today by going to finishchartingfaster.com. I'm so glad that you've been here engaging with me and this content about how you can build a better system to help you thrive in medicine. Can't wait to hear how this has impacted you and to see you back here for the next episode.